Two, one. Good evening from Bharatnagar, Nepal. This is Dr. John Bennett broadcasting live for Neurosurgical TV with the cooperation of Nepal Medical Center and the Neurosurgery Student Group of the ACNS. Tonight we have another great hangout with Victor Hugo Perez, the maestro of neuroanatomy. But first, let me introduce the panel members that are here. Good evening, Simon. Hello, Simon. Well, I guess Simon stepped away. Hello, Slaven.
Hello, everyone. My name is Slaven Gojkovic. I'm from Croatia and I'm a medical student involved in neurosurgery, and I'm really happy to be in this presentation today.
Yeah, I'm a big supporter of this platform. And Simon stepped away. Okay, Victor, thank you very much for coming, and it's all yours.
Professor, I'm so sorry. I'm really sorry. I have an emergency.
Okay.
I cannot participate right now. Okay.
Okay.
I send you an email later. I will send my CV for Professor Victor. Okay. I'm really sorry. Really sorry.
No problem.
Okay,
Hey,
I'm working. Sorry.
This is neurosurgery live. You're seeing this an emergency in action. Okay, Victor, it's all yours.
Okay.
Okay.
Bye-bye.
Thank you, Margarita. We'll talk to you soon.
Okay. Good morning here in Mexico. I know over there it's evening. Now here in Mexico, good morning. Yeah. We are going to start showing you some videos about the basics of neuroanatomy. Let's start with this video. Do you see the video?
Yes, we can, Victor. Very clear.
Okay.
We can't hear the audio. Is there any audio here, or do you want to just commentate?
No, we have audio. So you don't hear it?
No, we don't hear it.
Okay, what's happening with this? Okay, this is a longitudinal fissure. I remove dura mater. Longitudinal fissure divides the brain in two halves, left and right halves. Other prominent groups and sulcus or sulci separates the lobes. This is a lateral aspect of the right. This is the central sulcus, the precentral sulcus, area motor area, and sensitive area. This central sulcus is also known as fissure of Rolando. And the lateral fissure is also known as fissure of Sylvius. Parietal lobe, temporal lobe. That is the fissure of Sylvius. The central sulcus runs from the top of the brain, from there downward and forward, and it begins at about the middle of the rear and front pole of the brain. This is the lateral fissure runs backward and slightly upward. backward, slightly upward. This fissure divides the parietal and frontal lobes from the temporal lobe. If we separate this fissure, we can see the middle cerebral artery. So this is one video. I'm going to show you several videos. I want to ask you if you listen if you listen.
Okay.
Yes, we can
We'll
hear
tell you.
John Bennett, do you hear?
We can see. Well, you haven't turned the video on yet. The video we see, it's not on yet. The video, but we can't hear it. No.
Okay. Do you hear or not?
No. No. Do not.
Okay, but I am talking about the video. Do you hear or not?
No.
No. What can happen with this? Because I
Okay, you have to turn it on, Richter. That looks like the video is not turned on yet. Click on it because it's not. The video is not playing yet.
Okay.
There. Okay, there. Now turn it on now. And I'll see if I can hear it. Okay, turn it on in the middle. There we go. Okay.
Do you hear?
No, we cannot hear.
What happened? I don't know.
I don't know.
If I explain this, do you hear?
No. I hear you, but I don't hear the video.
Okay, no problem. I can explain that.
Okay, we hear you. Yes, we hear you.
Okay, do you hear me? Okay,
yes,
no problem.
Yes,
I can explain this.
Okay.
Okay, this is the sagittal sinus. If I remove this dura mater, I can see the longitudinal fissure. So as you know, this is basic neuroanatomy, but for students and also for residents, it's very good to know this basic neuroanatomy. Is very useful. Okay.
Excuse me.
Okay, let me show you another one. Okay. So, okay, let's go to here. So, do you see it, John Bennett?
Not yet. You're not screen sharing. No, you're not screen sharing. No, you're not screen sharing now.
Okay. Let me try again. Okay. Okay. Do you see?
Yes.
Okay. And also, do you hear?
Yes. Oh no, I don't hear the video.
Okay. But my explanation, yes.
Yes.
Okay. This is a precentral sulcus. This sulcus separates the horizontally oriented trigyrus superior, middle, and inferior frontal gyri. Superior, middle, and inferior frontal gyri. The inferior frontal gyri is subdivided in 3 gyri. This is a parietal lobe. Central sulcus. The lateral fissure inferiorly. This is the parieto-occipital fissure. From that point to the temporal notch, or a preoccipital notch, that is a preoccipital notch, we have an imaginary line from that point, parieto-occipital fissure, to the preoccipital notch. In the middle of this imaginary line, we have the limits of the temporal and parietal lobes. Okay, let me show you one more. This is the temporal lobe. The uppermost part of this temporal lobe is concerned with hearing. Damage of this part of the brain results in damage to hearing or deafness. The parietal lobe is behind the central sulcus, the parietal lobe. The precise limits of this, the precise boundaries, is difficult to precise. We can make later, John Bennett and dear colleagues, video with the explanation of the functional.
Yes, that would be great.
The occipital lobe is behind the parietal and temporal lobes. This occipital lobe is separated from them by the imaginary vertical line. The parieto-occipital fissure and preoccipital notch. Okay, let's see the other video. Do you see it?
Yes.
A minute, okay. This is the inferior aspect of the temporal lobe. The inferior surface of this temporal lobe can be seen much better if we remove the cerebellum. These gyri are arranged in longitudinal way and is discontinuous. The most medial of the gyri is the parahippocampal gyrus. That is the parahippocampal gyrus. It extends from the lingual gyrus there is a small hook-like convolution in the anteromedial part of this parahippocampal gyrus, and behind the optic nerve, this is the optic nerve. That is the uncus. Look the close boundary with the stem, brain stem. That is a collateral sulci. The anterior extension of the collateral sulcus toward the temporal pole is the renal cycles. Between the collateral sulcus and the more lateral sulcus, occipitotemporal, is the occipitotemporal gyrus. That is the occipitotemporal gyrus. Okay, another video. This is nice view of the brain. In this brain, I have removed the gray matter in order to see the fibers, the white substance, the white matter. Okay, let's go to see. Okay, this is the ventral surface of the brain. These are the vertebral arteries, left and right. Posterior inferior cerebellar artery. This is a very small artery. the anterior spinal artery coming from the left vertebral artery. In the left side, we have the posterior inferior cerebellar artery, basilar artery, and its branches. The anterior inferior cerebellar artery. Anterior inferior cerebellar artery. It's okay, John?
Yes, it is. Perfect, Victor.
Then after we can see what happened with the video, with the sound, and we can make some videos of this, John Bennett, to put in your program.
Yes.
So I think there is no problem for this.
Yes.
This is a posterior cerebral artery. This basilar artery bifurcates in posterior cerebral arteries, the right and left. This is the third nerve, oculomotor nerve. And behind the oculomotor nerve, we have the superior cerebellar arteries. These oculomotor nerves passes between the posterior cerebral artery and superior cerebellar artery. That is the right third cranial nerve, oculomotor nerve. This is a nice view of the polygon of Willis. The optic nerves, optic chiasm, infundibulum, mammillary bodies, and here we have the anterior cerebral arteries. The left, the supraclinode carotid artery with its branches, the posterior communicating artery and the anterior choroidal artery. This supraclinode carotid artery bifurcates in middle cerebral artery and anterior cerebral artery, known as A1 segment of the anterior cerebral artery. These arteries communicate through the anterior communicating artery. Let me show you the Hübner recurrent artery. I cannot displace these arteries better because this brain was injected with plastic, rigid plastic. But in other conferences, I'm going to show you that is a recurrent Hübner artery. The silicone or latex is very elastic. This kind of plastic is not elastic, so I had some difficulties to displace these arteries. Let's go to this. Anterior cerebral artery, posterior communicating artery, this artery is communicating the supracrinal carotid artery with the posterior cerebral artery. In the other side, we have the right posterior communicating artery. Anterior cerebral artery. This is the anterior communicating artery. That is the anterior. That small artery is the anterior communicating artery. This is the middle cerebral artery, lenticulo-striate arteries, choroid plexus, this is known as M1, M2, and M3, opercular segment, sphenoidal, insular segment, and this is the sphenoidal segment, M1, M2, M3, opercular segment. This kind of videos can be very useful for residents, John Bennett, because I'm going to show you in different conferences several brains, so the resident can see variants of the arterial pattern of the brain. Now, in this brain, I'm going to make a small lobectomy, a small lobectomy in the temporal lobe to see the M1 segment of middle cerebral artery, the right side.
Okay.
So I'm going to cut this temporal lobe. Some problems with the view. Slaven, are you seeing this the dissection?
Yes, yes, I can see it. It's great.
Okay, if I remove that, we are going to see the branches, the very important branches of M1. Specifically the lenticulo-striates artery. They are divided in three groups: lateral, middle, and intermediate group. In this case, we are going to see only a middle group of lenticulo-striates arteries.
When you say M1, Victor, is that middle cerebral artery?
Yeah, M1, middle cerebral artery, known as sphenoidal segment. M2 is this artery when it passes over the insula. Is known as insular segment. M2, insular segment. An opercular segment is known as M3. The cut of the brain is not easy because, you know, this brain has also 3 or 4 years in formol, so I have to remove in short pieces. It's almost impossible to cut this in only one piece. But at the end, we are going to have a really nice view. If I show you 15 or 20 dissections of these brains, Slaven, I know that you are going to improve your knowledge about cerebral arteries. I'm very sure that this can be very useful for residents and for students because it's much better to see this in video than in pictures. In video is more interesting.
It really is, and you can see it really as we go. How are you performing this? And I think this is invaluable.
Yeah, and you can ask questions too, Victor, which is great for video. You can't do that with pictures.
Exactly. You can interact with the dissection.
Yeah.
Yes, yes.
Well, you know, Victor Slaven in his spare time dissects rat's brains.
Okay. I'm actually, performing craniotomies on rats, but it is more animal model for craniotomy and increased intracranial pressure. So.
Okay. Look at this. This is the M1 segment, and those are the lenticulo-striates arteries. Really beautiful group of arteries.
Now, Victor, most neurosurgical residents don't have access to dissections like this, correct? Is that correct or no?
Excuse me again, John Bennett?
Most neurosurgical residents don't have access to dissections like this, do they?
Yes, of course, I know. Yes. In Mexico, also in Mexico, there is no access to this kind of dissection. So that is the importance of these videos, and also your channel, John Bennett. I want to tell you again that is very useful your neurosurgical channel for residents and students, and congratulations for that.
Yeah, we hope to continue to do these. And let me introduce Bernardo de Andrada from Brazil. Hello, Bernardo. And well, I guess he's not. But anyways, we were talking about that, Victor. In Brazil, he said there's very few laboratories.
Hello.
Yeah, hey, Bernardo.
Nice to meet you.
Yeah, this is Victor Hugo Perez, a maestro de neuroanatomia. Bernardo, we were talking before, and I think you said there's just a couple of neurosurgical anatomy labs in Brazil. In Brazil?
Yes, here in the city I live in, Rio de Janeiro, we have very small numbers of laboratories of neurosurgery. So the most parts of residents used to learn in patients, you know, watching the staff's doing and trying to do. The resident starts to operating trauma, and after will improving to became a vascular neurosurgeon or this kind of.
Yes, so these types of dissections are valuable, Victor. So I'm sure that people will be interested.
Yeah, and I am doing also some models of spine and also skull base. So they are made by Resina, and I think they are very useful because you know it's very difficult to get a real bone. So this is a scale of a spine, lumbosacral spine, and this is very similar to a real one. This is a copy of
very similar.
It's made of a 1:1 scale of a real one. So, and this is very useful to know the points of insertion of a screw.
Yes.
So I think this is very useful. As you can see in here, this is a non-degenerative spine, but let me show you a degenerative spine. This is the degenerative spine. So in here, you can see the change of the bone in a degenerative spine. So
very nice.
We have facetary hypertrophic facetary. So I put some disc herniations in this. The valuable thing of this is that this is a flexible spine. So I put in here, I put an herniation of this disc. So this is very useful for the knowledge of a spine. I have also some skulls, and this is like this is only like a toy in your desk, in your office, medical office. So this is a beautiful copy of a spine.
Well, Victor, Bernardo is going to, he has an interest in spine in Rio, and I'm glad he could come to meet you. He's going to be doing a fellowship at Barrows Institute in Phoenix, Arizona.
Yeah.
Are you going to be concentrating on spine at Barrows, Bernardo, or just general neurosurgery?
No, we are going to work in spine surgery, in spine lab.
Okay, here's the man. He's doing a book now on spine anatomy.
Oh, really?
Yeah,
yes,
he's writing a book right now.
Yes, first of all, I would like to congratulations on your work. I've been following you on social media for a long time. I'm really enthusiastic of your dissections, of your work. I'm very glad to be here talking to you, Victor.
Thank you, Bernardo. Now I am doing some research in spinal cord, specifically the vascular anatomy of the spinal cord. Let me show you some videos of this.
Oh, nice.
Of this. Do you see it? Do you see it?
Yes. Yes. Very beautiful dissection.
This is the caudequina.
Yes.
And this is. Do you hear it? Okay. Okay. Do you hear me?
We can hear
yes,
you.
Yes.
Okay. This is the posterior aspect of the spinal cord. The caudequina, some sensitive roots, and the posterior spinal artery. And let me show you this one. This is very interesting because, you know, this artery, the posterior spinal artery, let me put the video in that place. This is this one. This artery is not well known because some authors think that this artery do not exist, and other ones say that this artery exists. So that was about 40 years ago. Now I am doing this research, and I have the good statistics about the existence of this great posterior spinal artery. This is really interesting. This study was made in 50 spinal cords because it's difficult to have the measures of each vein or the arteries. So although I have 150 spinal cords injected, we are going to publish these fissures in 50 spinal cords. So I think it's interesting, this kind of work. So another thing is that I am taking video in all of these cases. Let me show you this video. Is really beautiful because you are going to see the injection of the veins of this spinal cord in the posterior surface. Do you see it? Do you see it?
Yes.
Yes, we do.
Okay.
Oh, very nice.
Okay, this is the trajectory of this spinal vein. Okay. Yeah, I am very impressed about this kind of studies. Okay, what do you think about that, Bernardo?
Yeah, very nice. I'm really enthusiastic of the spine anatomy. I have been doing a lot of surgery of spinal ependymomas, conus ependymomas,
Okay, good.
phylum ependymomas, and I really appreciate the anatomy of spine. And it's very important to learn how to put correctly a screw to examine a specimen and to have a anatomy model with you. You know, just learn on books. You can't do it well. You know, you can't learn it correctly how to put a screw.
Yeah, I know. Yes,
It's very
yes.
important to have this tact with a specimen. You know.
Yeah, I agree. Yeah. John Bennett.
You're muted, Dr. Bennett.
I'm sorry, I'd like to introduce Maria. Are you there? Maria, hello.
Hi.
Hi, welcome.
Hi, everyone.
I'd like you to meet Victor Hugo Perez, a neurosurgeon from Mexico. He's a maestro of neuroanatomy, and you'll probably be seeing a lot. You'll be seeing a lot of him. Now, was that true, Maria? Did you learn to operate a lot on cadavers, or did you have to learn, like Bernardo says, through trauma patients?
Oh, trauma patients, mainly in Argentina. I was trained in Argentina, and we don't have labs there. Many people from Argentina is going to Brazil now, but they used to go to the Evandros lab, but currently I don't think many people is going, maybe because they're having problems with the cadavers. I'm not that sure which one is the main problem, but few people is going there, and well, we're having that problem. We have to learn with patients, which I think it's not very ethical.
Right.
I think we should try to learn first with simulators or cadavers or whatever we have in the hand to learn better in order to improve our skills without damaging anyone.
Right.
Yeah.
Well, we hope to be pretty active in showing dissections by Victor online.
Yeah.
Because I went to the Baker Center in Miami to watch a dissection, and the picture on the screen was just as good as being at the bedside. Of course, it would be help to handle a tissue, but the next best thing is to see real good live dissections and be able to interact with someone like Victor in real time.
It's a very good thing. Thank you.
Yeah, so we're going to be making that step.
John, I was on Evandro's lab, how Maria said. It's a very good lab in São Paulo, Brazil. But in Rio de Janeiro, we don't have a laboratory, just have one. It's located in a military hospital, and we do not have access, you know. But this laboratory in São Paulo is very good, but it's not working this year, I think. I don't know exactly what happened.
I think the main problem is that Roton's lab is closed, and many people used to go there many years ago, and now we have having, instead of improving in terms of labs, we're getting worse. So I think the most specialized one we have already nowadays is in Pittsburgh. But I think there is not much more than that, and I think we should try to improve that, because
yes, the real problem here is the law to acquire a cadaver specimen.
It happens the same everywhere. Everyone has the same problem.
Well, you know, Victor's coming to Nepal to set up a laboratory here, but that doesn't get around the problem, like Maria said, of having a real lab where you can go to.
Yeah.
So I guess that'll be slow coming about, but hopefully we'll have a lot of sessions like this. Now, Louis, are you there? Louis, Raphael, let me get his experience with cadaver labs. Louis, can you hear me okay? Louis is in Mexico City also, from Chile. I guess not. So, well, any other? Okay, Victor, do you want to?
Yeah.
Do you want to continue on, please?
Yeah, I think every 2 weeks we will have this kind of dissection lab. Video, as I told you, is much better to show you some pictures. Video is very, very useful.
Yes.
For students, for residents. These kind of conferences are very useful for everybody. So I'm going to show you, for example, 20 brains. In one conference, the dissection of arteries of the brain. In other conference, the same. But you know, there are many variants in the vascular pattern of the brain. So that's very useful to know that kind of things. I'm going to show you in other conferences also dissection of temporal bone. That is also very useful. Anatomy of a skull base, and also we are going to make a surgical anatomy of plexus, brachial plexus and lumbosacral plexus. So I think we are going to make a good job, and I want to give you I want to tell you that it's very nice to me to see you here in these conferences.
You know, Maria, you didn't come until Victor is working on a book now on spinal anatomy currently. So he feels that part of the anatomy of the nervous system is neglected. So he wants to kind of bring attention to that part.
I think it's a very good idea.
Yeah.
Yeah, Maria Laura, every book is going to have this model of spine, of vertebral.
Good. I have seen it picture already when you show it that before. I was watching. Thank you.
Okay, this is really
a really good thing to learn
and very useful.
Yes.
To know the
anatomy.
Yeah, of course.
Thank you.
Can you please show?
You're welcome. Thank you to you.
Louis, let me just interject here. Louis, let me introduce Louis. Can you hear me okay? I guess not. I guess he stepped away. Okay, I'm sorry to interrupt. Go ahead.
Go ahead, Victor.
Go ahead, Victor.
Yeah. Again, the question?
No, that's okay. I was just trying to introduce someone that is stepped away, a neurosurgeon from Mexico City.
I would like to ask a question, if I may. I would like.
Oh, okay. Go ahead, Slaven.
Can you please show the herniated disc once again in the degenerate spine?
The spine?
Yeah.
This one?
No. The other one with the herniated disc.
The other one? There is too much noise.
It's better now. Okay. Yes. Can you show it?
Okay.
Yeah, it's better.
This one?
Yes. That was great.
Yes, Slaven. This is a degenerative spine.
Mm-hmm.
So you can see the bodies shortened. The vertebral bodies, and this is. Let me show you the lateral aspect. This is very useful because you can mobilize the spine. So each piece is connected with some ligaments inside the body of this vertebral. So this is. Then after, I'm going to send you, Slaven, a video about this, and also some pictures.
Please, I would be happy to have them.
For example, in here, I put a central herniation of yes. This L2, L3 segment of the spine, and in the L5S1, I put also a herniation in this part. So
it's very well visible here. It's a really good specimen. I really like this.
Yeah. Yeah. This is a copy. It's not real. It's just copy. Okay.
It looks very well.
Thank you, Seven. Some question, John Bennett. You are
Yeah,
mute.
sure. Any other questions or comments from the panel? Mansoor, how are you doing?
It's muted.
He's muted there. We're getting down to the sec.
Please unmute.
And Yosef, any comments or questions or? I guess he's muted too. Well, a lot of success with the people that are muted.
I think Mansoor
So,
is
okay.
having trouble. He's muted and
He's mute.
He's talking.
Okay, I think Mansoor, you need to turn off your mute button when you're talking. Mansoor, you can hear me? Turn off the mute button when you're talking. It's at the very top, right in the middle. I guess not. Okay. Okay. Very good. Okay. Anything else before we close it up?
I would just like to say that in the current situation when the labs are closing, as Dr. Maria said, I think it's great that we have our very own tutor in neuroanatomy. So it's really a great thing. That Dr. Perez, what you are doing is invaluable for us, and I would like to thank you once again for dividing your time and really teaching us neuroanatomy specimens.
Well, let me just say that Victor's coming to Biratnagar to establish a neuroanatomy lab, and we've also heard from a neurosurgical resident from India that wants to work at a lab. He's just finishing his fellowship. And in the beginning of the show, we had a neurosurgical resident from Portugal who has a big interest in neuroanatomy. So we have people all over the world that are coming around that have a big interest in neuroanatomy, and hopefully will participate in Victor's channel of neuroanatomy. We'll get more organized as we come on and more structured. And we're getting the technology down, but I think that the interest is there, and the platform is there to improve education and neuroanatomy for both residents and students.
Someone want to ask a question. I see that he...
Go ahead.
Yeah, Mr. John, can you hear me now?
Yes, is that Mansoor?
Yeah, this MM Idris from
hi. Could you please introduce yourself?
Yeah, I am Dr. Muhammad Mansoor Idris. I'm a second year senior registrar working in National Hospital in Abuja, Nigeria.
Oh, welcome.
Yeah, it's my pleasure to be in this quite unique and interesting forum. And I really appreciate the professor, the way he teaches neuroanatomy.
Okay, well, welcome. You're welcome to participate in any of our events.
Yeah, come up to you, John. You're doing a great, marvelous job.
Thank you.
Really appreciate you.
Well, we hope to reach a lot of neurosurgical residents around the world, especially in areas that are far away from everything.
Yes, more especially in the sub-Saharan Africa.
Yes, we have plans to include everyone in North Africa, and we hope to have conferences online, maybe neuroanatomy online, so that you don't have to travel, and we can get the same quality of speakers like Victor that can come into your computer without you traveling.
Yeah, sure. Yeah, thank you very much, Professor Victor.
Sure. Well, welcome, Mansoor. And Lewis, are you there available, Lewis? Come in, Lewis. I keep trying to get Lewis, rouse him. I think he's taking a long coffee break. Well, Lewis is a neurosurgeon in Mexico City. He comes from Colombia, but he's very active in the Latin neurosurgery section, and in addition, as Victor said, Mexico has a shortage of neuroanatomy labs. We hope to reach not only Asia with the neurosurgery channel, but all neuroanatomy channel, but also diffusely in Latin America. And Lewis is helping a lot with helping us get into the markets there. So, okay. Any closing comments for Victor? Well, I guess
just thank you to everybody to stay with me. So next conference is going to be in 2 weeks more. I think it's 15 August. We are going to make another dissection. Yeah.
Okay. Do you have a title for that talk, Victor, yet, or?
No, we are going to review some arteries and some functions of cortical brain.
Oh, very good. Okay, Victor, I'd like to thank you once again for giving a great presentation, and we'll close it up now so we can edit it. And thank you, everyone, for coming. Stay here, but I'm just saying goodbye officially.
Okay, thank you.
Yeah, bye-bye, George. Thank you.
Okay, stay there, everybody. We're going to edit this out. We're going to edit this out, but this is great. I'm glad you came, Maria and Mansur and Bernardo. I'm glad all you guys came, and also Joseph. Joseph came there, came late. The next presentation is, I hope he shows up, Bernardo. I'm sure you can relate to this. Joffrey had a couple of aneurysm surgeries, but he wanted to give a presentation. So let me see if I'm going to try to get a hold of him right now, see if he's going to come. Joffrey Portillo from Ecuador. Let me see if he's available. Okay.
Breaking into our emotions, stealing computers, treating people the way they did, they're going to expect that big technical balance. All the residents who vote. The Spanish government insists that they are behaving in that a breakaway vote for weeks in Belgium cannot go ahead. Any voters here dismiss that claim. Investigating the massive amount of people that want to vote for 80% of the population of the country. They have legality here in India. But we are in the freedom and democracy. This is exactly what national government for bringing the power of party. And they will not be doing their stuff. They're hiding out. People fear the parliament.
Okay. I just wrote to Joffrey to see if he's going to come. He may be like Margarita. He may have had surgery. Now, Bernardo, you came in a little later. Did you meet Margarita? I don't think you did.
Excuse me?
Yeah, did you meet Margarita? She was here at the beginning.
No, I didn't.
Okay, she's a resident in Portugal now. She's like Maria. She's kind of like waiting to get her license in Portugal, neurosurgical license. But she works in neuroanatomy. She's probably going to be working with Victor. And Bernardo, I got a communication from a resident from India that may be working with Victor here in Nepal in his neuroanatomy lab. He's looking for work in the field of neuroanatomy.
And how is the lab in Nepal? Is good?
Well, he's just going to start it. It'll be small, but the strong part of it will be the video. We'll be able to televise a lot because we'll be here. And we'll be able to set it up and try to get really good pictures and good videos to put online. That's the advantage we have. We'll be here with the lab. It'll be small lab, but and Victor will probably be working.
But we'll broadcast for all over the world.
Yeah, we'll be broadcasting everywhere from here under the supervision of Victor. He may have someone here directing him, but it'll be directly controlled by Victor. It won't be a big lab like Baker and like that, but it'll be. I think it'll be a good lab, and hopefully we'll run it well. Well, this is great. A Nigerian resident, Mansur.
Yes.
What, are you a neurosurgical resident?
Yes, I am.
Oh, fantastic! Welcome, welcome.
Thank you. Thank you. Thank you.
Well, you know, I'll be glad to have a hangout with you to show you around, because we certainly welcome Nigeria to the community we have here. We'd be glad to have you part of it. You and your residents and your attendings. So let's make it. You know, I'll communicate with you by email. Do you have my email address?
No, Professor. Can you kindly?
Okay, let me give it to you right now.
Okay.
How'd you get the link to come in? That's great.
Yes, I am on the WhatsApp chat.
Oh, good. Okay.
So I saw it with you on the WhatsApp chat.
Okay, there's my email. Do you see my email address?
On the WhatsApp group?
Yeah, I'll put it on WhatsApp.
Okay.
On the okay. Let me put it on WhatsApp.
WhatsApp.
Yeah, I'll put it on that. Okay, yeah. Oh, yeah, there you are. Okay. Yeah, yeah, I'll send my email address.
Great.
And let me know when you can do we'll have an informal hangout and show.
All right. I'll be glad.
Yeah, I'll show you how it works and what we have planned. Now I'm working with the neurosurgeon from Nepal. I'm in Nepal right now.
All right.
But he has a lot of African connections.
Great.
A lot. And matter of fact, do you speak French?
No.
Okay. Well, we're going to have conferences in English in North Africa. Also, matter of fact, one of the members on the panel right now, Louis Moscotti, is working on getting an African conference together online.
Great.
So he's not answering. Let me try to get him online. So I'd like you to meet him.
Great. I would appreciate it.
He's right on the panel there, but he's not hearing me. Hold on. Let me just send him a message.
Maybe you would like to do a presentation also.
Yeah, sure. As soon as I show him the ropes, I'll start. You know, we had a presentation last week, Mansur, by a neurosurgeon from Tanzania.
Oh, great.
Yeah, on hyena bites.
It was wonderful. Yeah.
Hyena.
Yeah, it was a really good. I'll send you. Can you send me your email address too, as well as the WhatsApp?
I am right now sending you that email.
Oh, okay, great. Okay.
I'm trying to open my email to send an email to you right away.
Okay.
Just give me a moment.
Okay, very good.
Yeah, I'll be right back, okay?
Yeah, sure. Yeah, we're still waiting for Joffrey. I don't know. He had a couple of aneurysm surgeries, so you guys know how that goes. It may have went longer than scheduled. Maybe he didn't get any rest for a while.
Around 2.4 million South Africans.
Sure, John. We would welcome you to Nigeria.
Well, you know, are you in the main city in Nigeria, Mansur?
Yes. I work with the biggest, the largest hospital in the country, National Hospital Abuja.
Okay.
It's still in Abuja. Yes, that's the capital city of Nigeria.
Okay. Well, one of the things I saw once I got involved with the neurosurgical community is the importance of continuing to study neuroanatomy. Continuing, it's a lifelong thing, and that's why I'm glad I met Victor. But what's it like in Nigeria? Do you have any cadaver labs or anything that you can use?
Not at all. Not at all. Not at all.
Well,
we solely depend on videos and textbook pictures. We don't have any throughout the whole country of 180 million. We don't have such a facility.
Okay, we hope, we've said this before, but we hope with Victor we'll be able to help fill that void of neurosurgery, neuroanatomy labs online. So you can see dissections like Victor just did. You came a little late, but yeah, he did an excellent dissection of the parts of the brain, and we're able to enter. The big difference, man, sir, it's not just watching a video. You're able to interact with Victor and ask questions, and he's able to address, concerns. So I think it's a little more valuable than just watching a video.
Yes, it is.
So, okay, we're still waiting for Lewis. Can you hear me yet? No, we can't. Youssef, can you please introduce yourself to Victor?
Yeah, sure. Hi, Dr. Victor. I'm Yusuf. I'm a fourth-year medical. How are you?
I think you may have met him a couple of weeks ago. You came to Victor's last talk, right? About 2 weeks ago.
Yeah, I did.
Okay.
Well, in short, my intro is like I'm a fourth-year medical student from Medical College, Pakistan, and I plan on pursuing neurosurgery. So this is a great platform, by the way, to meet foreign neurosurgeons. And Dr. Victor, you're a great neuroanatomist.
And Marco, could you please introduce you? Oh, Marco, you know Victor, right? Hello, Marco, are you there?
Yes.
Hi.
Hi, Marco.
You remember Victor, right?
Hi, good morning. I'm sorry, I had a lot of problems, technician problems. I saw in YouTube the conference, but now I'm here. It's good to see you, Professor Victor. How are you?
Thank you, Marco. Thank you. Very nice, very nice. How are you?
Fine, thanks. Fine. Thank you.
Victor,
it was.
Go ahead.
It's a good presentation. It was a good presentation, and we can learn a lot of neuroanatomy. And thank you so much. Thank you so much.
Yeah, well, Victor, he's in Mexico City now, Marco.
Yeah, I visited him and
he's studying. You're studying, right?
A month ago.
You're studying, Marco, right?
Yeah. Right. Yes. I'm studying right now, but.
What exam are you going to take?
No, it was in September 6th, the exam. Yes.
Oh, okay. You've finished it.
Yes, I finished. Yes, it was a great experience to visit Mexico City. So to visit Professor Victor, it was a great experience.
Okay, very good.
Thank you, Marco. Yes, I met Marco about 1 month before.
Oh, okay.
Yeah.
Okay.
Yes.
Yeah.
We saw each other. We saw each other in Mexico.
Mexico City?
Sí, in Mexico City.
Yeah.
Oh, great.
We saw each other.
Oh, great.
That was great.
Yeah, and now you're back in Bolivia. You're back in Bolivia now, right, Marco?
Yes, yes. I'm back here in Bolivia.
Okay.
Right now I am in La Paz, but I will travel to Cochabamba. I don't know if in 2 weeks or I'm not sure right now. But I will travel to Cochabamba.
Okay. Very good.
Yeah.
Very good. Let me try Joffrey again. I don't know if Joffrey may have had he had aneurysm surgery, so it probably went a little long. But yeah, and Victor, you know how that goes, right?
Joffrey, in US? US? In the US? Hello.
Hello. Okay, folks. We're waiting for Joffrey to come, but I guess his surgery may have gone a little longer than expected.
Expected. Yes, sure.
Yeah, he usually, Mansur,
Yes, Prof. John?
when you're not speaking, can you please mute your microphone? Because we're getting a lot of background noise from somewhere. I think the mute button is right in the middle at the top. Right in the middle of your screen, you'll see a microphone, just like everyone. There you go. There you go. Thank you. Thank you. Victor, I wanted you to meet Louis Moscotti. He's a neurosurgeon on the panel there, but he doesn't seem to be answering. But he is helping me arrange conferences in Latin America. He's arranged for a conference on neurocritical care December 2nd and 3rd online. He already has 30 speakers. Yeah, he really knows. He's going to be a big help to me because he's a neurosurgeon and he likes putting conferences together, and he's very active. I think he was working in Chile, but then he went to Minnesota for a while. But I don't think he's really working now. He's applying for fellowships, so he'll be doing a lot of work online, and hopefully he'll be able to help us, especially in the Latin community. He speaks both languages like you, which does help. But anyways, just waiting. So Victor, you working today? Oh no, today's your day off, right?
No, it's a day off. Yeah.
Oh, cool. So you're flying in. When you getting here to Baratnagar?
I'm leaving from Mexico on October 18. I think I will be there in October 19.
Are you going through Istanbul, or how are you getting here?
No, I'm going to Kathmandu.
Oh, you going direct flight from Mexico City?
Yeah, two scales, but direct flight. Yeah.
Oh wow, that's great. That's great.
With two scales.
Oh, two stops?
Yeah, 2 stops. Yeah.
Oh, okay. I got. Have you already got the reservations and everything?
Yes, I have the reservations.
Well, I was surprised that Turkish Air, they flew directly to Istanbul from Miami, and then from Istanbul to Kathmandu.
Okay.
So that was a really good connection, because normally when you fly from the U.S., you got to go through Frankfurt or some other city in Europe, but this was directly to Istanbul. It was a really good connection.
Yeah.
And I don't know if you spent any time in Kathmandu. Did you spend any time the last time you were here in Kathmandu? Or
I'm going to ask to Dr. Sheriam, who is what is the plan? But I think I can make just one night in Kathmandu, because I think I'll arrive at night. So right. I can go to some hotel over there, and then in the next day I can leave to Viratnagar.
Yeah, I stayed at a nice place right in the middle of the tourist area. It was very, very nice. I'll try to send you the hotel I stayed at.
Yes.
It was very nice, very clean, right in the middle of the tourist area. And
Yes.
I took a rickshaw, like to a tour.
Yeah.
And it was very convenient. Like just sitting in the rickshaw, going around to the temples. But there was a lot of damage done by the earthquake. Victor,
Okay.
you're going from one earthquake to the next.
No, we had one earthquake, very strong here in Mexico. We had almost 400 people dead,
Wow.
400. So several buildings damaged. So when I was in a tall building, about 8 floors. So I was in the middle.
Wow.
So
Wow.
when the earthquake began, I couldn't do anything. I tried to run but I couldn't, because
Really?
the earthquake began very hard. So I was very afraid. I thought that the building was going to collapse. I
Really?
thought, yeah, really, I thought that. I am really afraid of that, because we had a very strong earthquake in 1985. We had almost 2,500 of people dead. So
Wow.
I was helping in the collapsed buildings. So in this time, I was very afraid. Yeah,
Oh,
yeah.
Did you just hit the ground, or did you just fall, or?
No, I didn't know what to do. I didn't know what to do. I stay as paralyzed. So was very strong.
Wow.
Real, very strong.
Was everybody screaming in the building?
Yes, of course. Too many people screaming. There are
Right.
too many videos about the earthquake. Too many videos, and most of the people were very afraid. Were screaming. Most of them. Yeah.
Really?
So-
Wow. And the building was actually shaking, right? It was.
Yeah, of course. The bad experience in my life, the worst,
The worst, huh?
the worst experience in my life. So
Yeah.
I am living my second life.
Wow. Second life. Wow. Well, I guess you went immediately out. You take the elevator, or you run down the stairs?
I wanted to do that, go to the stairs, but I couldn't, because if I tried to run, I was going to fail, so
Yeah.
or injury myself, because
Right.
it was very hard. So I couldn't do anything.
Yeah. And how long did it last?
More or less 1 minute, 1.5 minutes, more or less, 1.5 minutes.
Must have been the longest minute and a half that you had.
Yes, yes.
Oh wow.
And
then there was no tremor for a while, or was it a couple of shakes?
Shakes.
Well, tremor.
Yeah.
After a minute and a half, it stopped totally.
Stop totally. Yeah, stop.
Totally. And when was the next tremor? Wasn't there another tremor later?
The other tremor was about 2 days. 2 days after. Three or 4 days after.
How strong was that?
6.1
Wow.
level. It
still
was
strong.
yeah, not too much. No.
That's still strong.
No, not so much.
No.
No. The first one was very strong. Yes.
Oh, so once you hit 7, that's when things start to shake.
Yes.
That's it.
Yeah. You told us that in Nepal, you had a very strong earthquake. Yes, I know. It was about 8 or 10 years ago.
Yeah.
Yes.
No, well, this one Kathmandu just had like maybe 5-6 months ago in Kathmandu.
5-6.
Yeah, they just had one about. It couldn't have been more than as less than a year ago. But
Oh,
when I went to Kathmandu, I saw all these temples collapse and damage, and I thought it was a lack of care, but it was because of the earthquake. The earthquake damaged a lot of temples in Kathmandu.
wow.
A lot.
How many people dead?
Oh, I don't know. I think it did cause damage with human life, but it caused a lot of physical damage to the temples that are very old. And unfortunately, I'll never see them. We'll never see them again. They're rebuilding. They're rebuilding, and I thought it was initially because of lack of care. But no, it was the earthquake damage that they're just starting to fix them now.
Okay.
So
Okay.
but still, you can see if you take a rickshaw when you get to Kathmandu at night, if you still have time, or in the morning, I suggest taking a rickshaw tour of the temples. There are still some temples that are very, very old, much older than Mexico City. Much older than anywhere in the United States. Very old.
Yes.
Very old. It's a very old city. Very old city.
Yeah. Later, you should suggest me what temples I can visit.
Okay.
Yeah.
I don't know it well, but there's a lot of old Buddhist temples there. Buddhist. Okay. It's just one of the centers of Buddhism. I didn't know that before I came, but it was. It's one of the centers of Buddhism. I didn't go to the temple, but there's one. I think about 7 kilometers outside of Kathmandu. It's one of the biggest Buddhist temples in the world.
Wow.
It's got a lot of history in Kathmandu.
Yeah, nice.
Yeah, but are you into history, Victor? Are you into that?
Yes.
Okay, well, you like that. I know Mexico City has a lot of history. And you know who gave a great presentation at a pediatric neurosurgery conference? Fernando, I don't remember his last name, but he talked a lot about the history of the Aztecs and everything during his presentation. It was excellent.
Okay, yes, Fernando Ponce de Leon.
Yes. He is a big historian. He loves history.
Yeah, Fernando Chico Ponce de Leon.
Yeah. He likes to speak of the history of Mexico City.
Yes.
During his presentation, he gave an excellent presentation of his introduction was the history of Mexico.
Okay.
In the time of the Aztecs.
Yeah.
Are you into that? The Aztec history and?
Yeah, I like Aztec history. So, have you visited the pyramids?
No, I haven't.
Pyramids?
No, I haven't. Okay. But I've read a lot about it. I was in Guadalajara, but I really didn't explore Mexico City when I was there.
When you come here, we can go together to the pyramids. It's very close to Mexico City, about 30 minutes.
Yeah, I understand. It's full of Aztec history and full of history in Mexico.
Yeah. All of you guys, all of you dear colleagues, when you come to Mexico, we can visit some places here in Mexico. Slaven, when you come to Mexico, all of you.
There you go.
Come to Mexico.
Do you know about the Aztec history, Slaven? The history of the Aztecs?
Yeah, it's very, very important in world's history in general. So we studied a lot about it, and I'm really interested more interesting to me, let's say, than the Egyptian history, for example. I don't know why, but it's a very interesting topic, and the Aztecs.
They were very advanced civilization, and of course the Spaniards ruined that. They took everything, took the gold, destroyed the temples.
Yeah, it was conquista. The war was very, very rude, and it was very, how can I say, very. The wartime was very bad.
Yeah, very violent history.
I was very interested in the history of South America too, where there were lots of cannibals, and you have a text from people from Germany who went to Brazil, what is not Brazil, and there were cannibal tribes, and one of them got captivated, and he lived there for 8 months, and he wrote the true history of his how they cooked people and ate them and everything, and it's really.
No, who was that? Who was that again?
I don't remember right now, but it was this.
A European explorer? European.
Staden. His last name was Staden. Hans Staden. Hans
Okay.
Staden from Germany, and he was captivated. He was exploring the world, and he went on a boat. And when they came to what is now Brazil, the coast of South America, they captivated him and they held him for 8 months, and he survived only by convincing them that his gods will be mad at them, at the cannibal tribe if they hurt him or anything.
Wow, if they eat him.
And it's how they ate people, you know, how they I mean all the how they killed them, you know. They had this giant club, you know, with which they crushed the skull, and I don't know, it was very, very interesting. So I think the history of America is, in general, you know, living in America, both Americas and history is more interesting than Europe. Europe is an old world. You know, kind of, I don't like Europe. Everything is, you know, so average, you know, here. Nothing happens. We don't even have earthquakes.
Well, they have interesting parts, but the Aztecs, they used to tear the heart out, right, Victor? They would, of the sacrificial victims, they would just reach into the chest and pull it out.
Yeah, the history tells that.
Yeah, wow, brutal part, brutal part. Bernardo, did you hear about that? The cannibal tribes of Brazil that Slaven was talking about?
I think maybe this tribe that he's talking
Long
about
time
is
ago,
Tupinambás.
Where's that?
Tupinambás were cannibal.
Yeah, true.
Were cannibal tribe in South America, but they didn't exist more.
Yes.
Oh, okay.
Yes.
It was in the
Yes.
That was a long time ago.
2 centuries or 3 centuries ago. Yes.
Tupinambás,
Okay.
Yeah. Yes. Now we have some Indian tribes in Amazons that didn't have contact with the what we call white men. But
Have you ever gone to the Amazon, Bernardo?
no, I never.
Okay. Well, Brazil is such a
With
huge
Portuguese.
country. It's a huge country, huh?
Yes, very huge. It's a very different cultures. When you go to the north and you go to south is very different. You know, the language is different, the culture and foods, everything is very different in south and north of Brazil.
Is it-
John Bennett.
yes.
John Bennett.
Yes.
Yeah, I send you a small video and some pictures of brain that I showed you today to TV Neurosurgical to the WhatsApp.
Oh, okay. Well, I'll
in
put it on
WhatsApp.
right. Yeah. Okay. You want me to
Yeah.
post it on WhatsApp?
Okay, yeah.
Hi, John. Can you hear me, sir?
Yes, you can, Mansour.
Yes, I have sent you an email address.
Good.
Yes, and I'll be following you further on the both email and WhatsApp.
Okay.
And I wish Professor Victor all the very best. I have to leave. I have some papers I'm trying to put together. So
Okay.
I will see you next.
Okay.
Yes.
Welcome, Mansour. We'll be talking to you soon.
Yeah, all right.
Yeah.
Okay.
Great.
Bye.
Yeah, I guess Joffrey Portillo, a neurosurgeon from Ecuador, apparently he said he was going to have aneurysm surgery, but he would be done. But I guess, as you guys know, it probably went longer than expected. So I don't think he's going to have a presentation. But anyways, So
Okay.
yeah, yeah,
John Bennett.
yeah, Bernardo.
John Bennett.
Yeah.
John Bennett. I have to go. So I'll see you, dear colleagues, in the next conference.
Yeah, in the
thank
2
you.
weeks. In 2 weeks before you come to Baratnagar, I'll see you in 2
Thank you.
weeks.
Thank
Nice
you
to meet you, Victor.
Thanks,
Nice
Victor.
to meet you, Bernardo.
Thanks, Victor.
Thank
See you.
Have a good day.
Greetings from Mexico City.
Thank you.
Okay, Victor.
Thank you. See
Okay.
you. Goodbye.
Yeah, yeah. This is Nepal, Victor. You got to learn this.
Yeah, yeah. Okay.
They do a lot of things.
Like here, like this.
Yeah, like this.
Okay.
Yeah,
Okay. See you. Bye bye.
Okay, see you.
Bye. Bye, Professor.
Yeah. Well, you know, Bernardo, the police, even the police here in Nepal, if you're a doctor, you're considered royalty here.
Wow.
And they salute you like this.
Oh, really?
Yeah. And they click the heels together. And I'm like, oh my God, policemen have never treated me that way.
In the States, yeah.
Yeah, usually they say, put your hands behind your back.
Yeah.
Oh, really?
You have the right to remain silent. It's, yeah.
Yeah, it's
So,
a little
are
different
you-
here.
Are you broadcasting now or not?
No, let's stop.
Can I
Swear.
show you a case? Or
Yeah. Well, you want me to start another broadcast? You want to do that or?
No, you know, just a little case of
Yeah,
spinal
yeah,
cord
okay,
tumor
sure.
I had.
Sure.
Nice.
Hey, you want to do another presentation, Bernardo, or you want to just show it informally?
No, just informally. I didn't.
Okay, no
prepare
problem. Okay, we
nothing.
won't. Okay, we won't. I'm sure Slaven will appreciate it, and
Of
Marco.
course. Thank you so much.
Yes, this is
Yes. Thank you.
this is a young guy with 40 years that started low back pain, irradiating to both legs, and I will show you the here MRI. Here is the. Let me just screen share.
4-year-old pediatric patient.
Excuse me.
A pediatric patient. Pediatric.
No, it's about 35 or 40 years.
Okay.
It's not pediatric patients.
Okay.
So here is the exam. Can you see it?
Not yet. Not yet.
And now, can you see?
Not yet, Bruno. You're not sharing the screen. You gotta.
It's hard.
Okay.
Yeah, you gotta click on. There you go. There you go.
It's now, yeah.
Okay, just pick the right screen to share. There you go. There you go. We see it.
Here.
Perfect.
And he have this mass in the spinal canal. You know, this is the conus,
Right.
and this is a mass, a lesion. Let me show you another. Here's the MRI. Here's the mass. And here you have the axial view. Here. Can you see it?
Yes.
I think this is the best image of the lesion.
Okay. That's huge.
Yeah.
It's about in L5, 4, 3, 2, L2.
Was he paralyzed? Was he
Corresponding to
paralyzed?
L2. No, just just sciatic pain, bilateral sciatic pain. And this is the video. So here is the nerve roots. Here is the proximal filum, and this is the lesion. This is the mass. No, are you seeing?
Yes, very good, very good.
Yes. This is the filum. We have cut this filum after coagulate, and this is after we are pulling the lesion, and this is the tumor. This is the quina cauda, and this is the lesion.
Yeah, it's really big. It seems.
And this is the other part of the terminal filum. This is the caudal part. This is the cranial part. I'm showing the tumor, and the caudal part of the terminal filum. We are going to cut it and then remove the lesion. Here you can see the coagulating. And now you have the proximal part of the filum and the caudal part of the filum. This is a tumor from filum terminalis. And this is the nerve roots after removal.
Great. Was that?
Yeah. This is the tumor.
It doesn't look big there.
Yeah, it's about maybe 4 or 5 centimeters. It's all we did 2 or 3 weeks ago.
And patient didn't have.
Yeah, had discharged it very well. Improved the pain. He's not in pain anymore.
It was a benign lesion, Bernardo?
Yes, it's an ependymoma, low-grade ependymoma.
Low-grade. So there's no spray. You had to
it
get
was
the whole
totally removed, so it doesn't require any X-ray therapy or
radiation. Okay.
Yeah, radiation.
He recovered completely. Did he have any symptoms before that, or was just picked up on a routine MRI?
No, he has a pain. He was on pain, lumbar pain with both legs.
Oh wow! Did the pain resolve after removing the tumor?
Yes, immediately after. He woke up without pain.
He must have been very happy.
Yes, it's a very good case.
Wow, that's great.
I have a couple of cases of tumor in spinal cord canal. I will organize it and maybe prepare some presentation for the hangouts.
Yeah, that would be excellent. That would be excellent.
Something also. Do you have any interest in how do you say spinal fixation procedures with neurosurgeons? I mean, when disc herniation and when you put screws inside.
Are you asking if I have been?
Because I would be interested if you would maybe make a presentation about some essentials of this, because it seems to be hard to grasp for a medical student.
I usually do a lot of spinal fixation, but in most parts is for degenerative disease, because the movement is the beginning of the problem. So you have a degenerative segment, and you can treat doing the fusion, the arthrodesis to treat. I have a lot of cases, but it's not now. I have to rescue it on my external HD and prepare for showing you.
Maybe.
But the indications for surgeries, it's controversies. It's hard to learn. We have to accompanying a lot of patients to start. I have very difficult to learn how to indicate correctly as this procedure for spine disease.
Yes, because when on Instagram a case like this comes and discussions, I really can understand it. It seems a very complicated area, so it's...
Yes. You have to understand the concept of instability to understand the fusion surgery. You have to understand this concept, instability of spine, the movement, the biomechanical concepts. We can talk about that, but it's a long.
Yeah, long talk. Okay.
No, it's a lecture.
Lecture.
When you have some elements removed, like a disc, you have to put something at substituting, you know.
Like an artificial disc.
It can be an artificial disc, or it can be a cage, like a cage.
Or like a
static.
bone fusion.
Yes, a static static cage that you put with bone grafts inside, and it will perform the fusion of the both vertebral bodies.
And does it when you operate the patient with herniation, you replace the body? I mean, do you often replace the body if there is a herniation?
No. You if you operate only disc herniation, you can replace only the disc. You can keep the vertebral body.
I mean, but you replace the disc, and is there any is the movement the same, or are there any
No. It depends. If you use a cage with bone graft, you remove all the movement. It will be an static
like
segment.
Yes. Like completely passive, cannot move.
Exactly. It will perform a fusion between both vertebral bodies. So the movement has no more movement. It's an static segment. But if you use like John Bennett said, an artificial disc, you can keep the movement. It's not exactly the physiologic movement, but
there is
some parts of movement. Yes, exactly. But the most part we use an static because when you have a fracture, you use a cage. When you have a severe degenerative disease, we use cages. It's the indications for mechanical prosthesis is very restrict. You know, the indications to use artificial disc is very restrict. It's very narrow. Yes, exactly.
Thank you very much. This was a mini lecture. So, and I really learned a lot because I was there is one friend of mine who has an L5 herniation, and she's going to be operated soon. So I was interested. I had something, but I wanted to check this. So, and it's really good to listen.
It's very controversial because there are some surgeons that do not like to perform the fusion. So in these cases, we advocate that soon the patients have maybe will get in pain again. So if you perform the fusion, you have another complications like adjacent level disease, degenerative disease. You can start degenerative in the disc above, you know. So it's a controversial, very controversial field.
Very interesting. Very interesting. Because
But if you understand the concept of instability of spine, you can understand better the indications for fusions. You basically indicate the fusion when you to prevent or to treat an instability. It's a segmental fail, you know.
Yeah, yeah.
It's like a building. If you remove the base of the building, you have an instability. Can you understand?
Yeah, yeah.
So like it's basically a biomechanical concept. Yes.
Yes.
How do you determine instability and stability? How do you determine that?
Yes, there are some. We have the 3 columns of Denny. If you look for it,
Okay.
you basically divide the column in 3 parts: the anterior and the medial part. The anterior is the disc, the anterior half of the disc. Yes, let me show you some pictures. Yeah, I can. It's very easy. You divide the column in 3 parts: anterior, the medial part, and the posterior part. If you have impairment of the 2 or more columns, you set this column as a instability.
Yes. So two must be arranged.
Yes, 2 or more.
Yeah.
It's,
Very interesting.
yeah.
Mm-hmm.
Yes, this is this 3 columns is.
Mm-hmm.
Let me show you.
You can see that lots of people have problems with this. So.
Here is the anterior column,
Yeah.
the middle column, and the posterior column. If you compromise 2 of these segments, you can say that this column is unstable.
Very. It's great. Because I see that many people have problems with this. It seems that this spinal instability becomes because this friend of mine, she is only 23 years old. She already developed herniations, and I mean, it's very interesting that she doesn't.
Yes.
She's athletic. She's not obese or overweight or anything. So looks very athletic, but she didn't train anything either. So I'm really interested how this.
Yeah, the cause of the degenerative is still not very clear.
Yeah.
What we know that the dogs doesn't have, so it's a human's conditions. Maybe because we are bipeds. Yeah, exactly. The erect of spine cause these gravity problems with loads.
I have one thought, but I hope we are not online, so I can tell it. I mean, that we are not live. I think
No, we're not live.
Very huge breasts, but, you know, because of the huge breasts. Yeah, so maybe this weighs too much. Really, she's specific to that, and I think that because she developed hyperlordosis. I mean, in women, it's usually they have more profound osteoporosis. She also has. So I think that maybe the weight of the upper body is the cause, but it's all speculation. Thank you very much. It's really great, and it's really great to hear something about this in the lectures.
Very good. Okay, hey, thanks everybody for coming. Bernardo, thanks a lot for showing up.
Okay, it's a pleasure.
Thank you.
I'm very
Thank you
glad.
so much.
Okay, and we'll see all you guys soon. I'll send you
Okay.
I'll send you the copy of the video.
Bye bye.
Please.
Have a
Okay,
nice
Bernardo,
day.
Thank you.
Thank you. Thanks, Slaven.
Bye,
Thanks, Marco.
Slaven. Bye,
Okay.
everybody.
Goodbye, Slavin.
Good night. Good night, everybody.
Good night.
Bye.
See you.
Hello, Louis. Are you there?